I have diabetic nerve damage, and I really don't like to take the medication for that because of the baleful side effects. Is there any help for me? I'm taking insulin and diabetic drug medication. Is there anything I can do naturally that will help to manage my glucose levels? Well, today's program is just for you, entitled Diabetes and Botanical Medicine, so stay by. Hi, welcome to Abundant Living. This is Curtis Akins, and I'd like to introduce my beautiful bride, Paula Akins.
Hello.
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 You doing fine today?
I'm doing wonderful.
You're
Praise the
wonderful
Lord.
too.
Praise the Lord.
Praise the Lord.
Thank you. Thank you.
And thank you for being with me on all of these programs, by the way. Just want to
absolutely
publicly thank the people as they're listening, that I'm thanking you for that.
Publicly thank the people?
I want to publicly thank you in front of the people while they're listening. Okay, just get yourself together.
Okay.
Now, anyway, this is a running series on diabetes, defeating diabetes. This is a series, and this is the last part of a 4-part series on that. And we're going to be talking about diabetes and botanical medicine, not just botanical medicine. We say botanical as opposed to herbs. Okay. Botanical because we're dealing with botany, but some people use the word herbs, so we can use that probably interchangeably. But we're also going to be talking about supplementation too, in relationship to nerve damage, neuropathy as well. So want to stay tuned for all this whole series, Defeating Diabetes.
Defeating Diabetes. We've been through a whole lot talking
yes,
with
we
different
have.
things.
Maybe don't want to do a little quick review of that.
You can go ahead on and review. I mean, everything's going to be in our workbook. And so,
well, that's true too.
I know we've got quite a bit we're going to cover, especially with botanical medicine, looking at botanical medicine.
Okay.
So they need to just either, get the workbook.
Okay,
all
it's
right.
all there.
I want to start off because when you think about diabetes, you always hear about nerve damage, to the feet specifically. So talk a little bit about diabetes relates to nerve damage.
Yeah. A lot of people who are diabetic do have nerve damage. Now, the medical term is neuropathy. Neuro meaning nerves, neuropathy, nerve damage. And up to 40 or 50% of people have some type of nerve damage. The reason being because when there's too much glucose, blood sugar, in the bloodstream, it damages the nerves. So nerve damage. Now, with that in mind, we have basically 3 types of nerves. We have the motor nerves, and this deals with muscle weakness and cramps. Okay. So people who may have weakness in the muscles, the legs, whatever, then that's usually because of the motor nerves are damaged. That's one type. Another type we have is called sensory nerves. And those nerves is due to the symptoms are the numbness, pain, a shooting, a burning sensation in the fingers and toes. Sensory nerves. And so when people have that, it's usually because their sensory nerves are damaged. All right. And then the last group of nerves is the autonomic nerves, which is basically involuntary, such as the nerves in our stomach. We call that gastroparesis, the medical term. And when this happens, the symptoms are when we eat food, since the nerves in our stomach are damaged because of the high glucose, blood sugar, in the bloodstream, it damages the nerves in our stomach. Now, as a result of that, we have bloating, we have indigestion, food simply does not digest properly.
Wow, that's a lot of stuff going on.
Yeah, yes, it is. And we can also include foul breath as well. We do have a picture of a nerve damage, neuropathy.
Okay.
So let's look at the screen at this time. And then you have it here, of course, this is a sensory nerve dealing with the fingers and toes, here dealing with the toes. And you see here a reduced blood flow at the top there. And then as the nerves get smaller in the feet, of course, you have the damaged nerves, and that's due to high glucose, high blood sugar in the bloodstream, and it damages those nerves. That's why you have the tingling, the numbness, the burning sensation in the toes and also the fingers as well.
Wow. Is there any drugs that can help with this?
Yeah, there are some drugs that will help with the nerve damage. Probably the most well-known drug is Lyrica. You probably heard that on television. Lyrica is the main drug of choice for nerve damage, for those who have that diabetic nerve damage, I should say, put it that way. But of course, now with all drug medication, of course, you have side effects.
I know.
And so some of the side effects of that drug, and of course, this is well known on the container, a lot of people have allergic reaction to Lyrica.
Such as?
Well, number one, some, of course, like I said, their allergic reaction is swelling of the hands, the face. That's quite common with Lyrica. Also, dizziness. A lot of people experience that. Not everybody, but some people. Sleepiness. That's another side effect of Lyrica. Now, that's the good news. The other thing is that you also will experience, some people, blurred vision, weight gain, increase of depression, and suicidal thoughts. So because of these baleful side effects of dealing with this nerve damage, just as of late, which is somewhat of a surprise, the American Diabetic Association has just published a book on herbs and supplementation for the diabetic, the American Diabetes Association, which is quite weird because they don't really get into herbs.
That's true.
So I think because of these baleful side effects, they see it necessary to go ahead and publish a book on that, and I kind of brief through some of that, and at least they're going in a good direction. Because a lot of people are taking these supplementations and herbal medicines anyway, so they say they might as well go ahead and publish a book concerning that as well. But you can see, you can understand why they publish that type of book, because a lot of people are moving in that direction because of the side effects.
Absolutely, absolutely. A lot of times, you know, what's going on now is people are going to their doctors and trying to find out what's going on. You know, all the commercials out now, it scares you half to death. You know, once a new drug comes on the market, then they begin to show the side effects. Sometimes it goes long and long and long and long, and it's scary.
Yeah,
it's scary.
It really is.
Well,
and a lot of people wind up taking other drugs to remedy the side effects of another drug.
Yeah.
And so the list gets longer and longer.
Any natural modalities available then?
Yeah, there are some natural things that a person can do that's been clinically proven to be very effective. And of course, in your workbook, we have a whole list of clinical studies as far as this natural product is concerned in relationship to lessening the damage of our nerves due to a high glucose in the bloodstream. And so with this in mind, and this is a product that naturally is produced by the body, a bioflavonoid. Let's go to the screen and let's look at this product at this time. It's called alpha lipoic acid. Again, it's naturally produced from the body.
Wow.
Total symptom score, that's TSS, including the pain, burning, and numbness in feet, decreased significantly from baseline to day 19. This is the medical journal called Diabetes. In other words, interpretation of that is where a person has, let's say, the sensory nerves, fingers and toes. They have the burning, they have the pain, they have the numbness. Alpha lipoic acid, get it in any health food store. Based on that study, it was 800 milligrams per day, and over the course of less than 3 weeks, 19 days, saw a significant decrease in the pain, the burning, and the numbness. Wow. So it eased the symptoms of nerve damage, neuropathy, alpha lipoic acid, and virtually without any of the baleful side effects that the other drug can give. So a lot of people are now moving in that direction, and therefore they can see a better improvement on their overall life.
What about diabetic drugs?
Well, again, same as the other drugs for nerve damage. Of course, diabetic drugs also have their list of side effects as well. Probably the most well-known one, been in the paper and the news as of late, is Avandia.
Oh, yeah.
You heard that,
yes,
Avandia.
yes.
And what they've done is they collected 42 clinical studies. We call this meta-analysis. We'll look at 42 studies, put them all together, and analyze all 42 studies on this drug, Avandia. And they discovered that this drug also causes dizziness and drowsiness. But also discovered that a group of, a lot of clinical studies done on this, a group of individuals took this drug. They realized that over 50% of the people had a heart attack on this drug, Avandia, for diabetes. And some 63% of the people died from a cardiovascular event, either a heart attack or a stroke, by taking this drug, Avandia, for diabetes. And because of that, of course, there's a lot of litigations, lawsuits, hundreds of them because of this as well. So the Food and Drug Administration simply had to pull this off the shelf because of the baleful side effects of this drug. There's other drugs out there as well who may not give that drastic baleful side effects, but that's just one drug that people are using, they were using at that time, and they realized that it's just not doing the job that most people want them to do, want the drug to do.
Well, you know, it's one thing to have a debilitating disease, and then another thing to get some type of a drug that's supposed to help control or cure, but then to have extra side effects to go along with that as well. So I know that someone's asking the question, is there any herbal or supplementation that an individual can begin to take or take that can help to keep from having these types of side effects?
Yes, and absolutely. There are so many herbs, botanical medicine in the plant kingdom that can lessen the glucose in the bloodstream and bring it into its normalcy. Many herbs that can do that. You have cinnamon, you have fenugreek, you have golden seal, you have garlic, you have onions, bitter melon. I mean, the list goes on and on. However, there is one botanical, one herb, head and shoulders above all other herbs that can actually does a remarkable thing as far as diabetes is concerned. Let's go to the screen at this time because this is really a remarkable statement. New birth. The botanical, the herb, Gymnema Sylvestre, this is a leaf extract, significantly increases the regeneration of beta cells. And this is from the medical journal called Phytomedicine, Phyto meaning plant medicine. And the reason why this works so well, because when we talked about this in a previous program, chromium enhances the accessibility of insulin.
Okay.
Chromium, the trace mineral that we talked about, that we can get in broccoli and also whole grain products, all right, the breads, the buns, that kind of thing. So with that in mind, of all the herbs in the herbal kingdom, Gymnema Sylvestre has one of the highest contents of chromium.
Wow. Okay.
That's why you know that Gymnema Sylvestre works very well, and based on good sound clinical studies, we're looking at about 400 milligrams per day. And so in time, when a person does that and uses this particular botanical, we always emphasize if you're using any type of supplementation, any type of botanical medicine, always make sure that your healthcare professional be aware that you are using some other type of products other than the drug that was prescribed for you. That way they can monitor you, you can monitor yourself, and they're able to make some necessary adjustments to your medication, because once this herb begins to regenerate the beta cells, and again, this is very important, beta cells are the only cells in the pancreas that produce insulin, the beta cells.
Okay.
Therefore, once they are regenerated, give the beta cells new birth, then the insulin is now being produced more and need less of the medication or less of the insulin, even for those who are taking 20 or 30 units. So this is part of a total protocol, a total package as far as normalizing those glucose levels, Gymnema Sylvestre. And this is purchased at any health food store.
Now, I know, now you've done this before. We've talked about a disease and we've talked about medication or a drug that might be taking. And then someone asked a question about what can you do from a natural standpoint, and you do that. Then we always have people in the audience, in our community, in our church, that will say things like, can I take Gymnema Sylvestre and I do not have diabetes?
Yes.
The answer is no. You know, if it's not broke, don't be trying to fix it.
That's
you know what
true.
I'm saying?
Absolutely.
So you don't need to go out and take Gymnema Sylvestre, you know, as a precursor, or we say precursor because we think we might. But basically, you're talking now if the drug is being offered to you, to consider Gymnema Sylvestre,
right,
along with your medication.
Right. Now, that's a good point.
Checking with your physician, letting
Yes.
them know what's going on, and then you're going to see the drop. Now, remember, now it's not. We've been talking also about exercise, talking about food. We're now on botanical medicine, and those of you who missed the food and the exercise, you'll have to go back and get the workbook on that. But that's very, very important to know. We don't need to take it if there's nothing going on.
An excellent point, because this is not a magic bullet.
No.
A lot of people will take that herb, that botanical, and do nothing else. This is part of a complete package.
Yes, yes. We talked earlier also on exercise about sunshine, you know, getting out there and walking. So what role does sunshine play as far as this is concerned too, as far as diabetes?
Well, yeah, it plays a very critical role. Now, this is something that anybody can do without cost, without price. When sunlight strikes the skin, it moves the glucose in the skin into our muscles and liver automatically.
Wow.
And we'll need about maybe 10 to 15 minutes of sunlight exposure. Now, make sure the skin is dry and clean, and more skin exposed, the more sunlight properties you'll get with that as well. And of course, you know, you want to expose the skin, but of course you want to be decent at the same time as well. But again, sunlight will move that glucose out of the skin, out of the bloodstream, and move it into our muscles, stores it, or into our liver and stores it. Sunlight does it automatically and lasts for several hours. So sunlight is very good for that. So we're giving a lot of people a lot of information, honey, about sunlight treatment, also botanical medicine, herbs, supplementation for nerve pain, neuropathy. We talk about carbohydrates, the right carbs, and so positive thinking, and a lot more is in your workbook. So hopefully these lifestyle adjustments can be enhanced and improve someone's overall well-being.
And along with all that, we also threw in, or put in, or added in the part of the nutrition as far as recipes are concerned.
That's right.
So you get a chance to also have the recipes that match up with the different shows as well.
Absolutely.
Well, today is also one of those days. We're actually going to be doing a chicken salad. That's a mock chicken salad. It is fantastic, tastes good, looks good, and so we want to get your paper and your pencil and meet us in the kitchen.
Would you like to learn more about preparing healthful vegetarian dishes? If so, then you want to be sure to order our free Abundant Living resource sheet. It contains useful information about products and cookbooks that will help you to learn more about this natural way of cooking. Along with your order, we would also like to include a free copy of the booklet, The Natural Way to Keep in Shape. This 20-page booklet is filled with tips that will help you to develop a total lifestyle approach to health. To receive both the Abundant Living resource sheet and The Natural Way to Keep in Shape, call us at 800-752-3226 during regular business hours. Call and ask for this special offer today.
Well, welcome back. Welcome back.
A lot of information there.
Yes, lots of information. Very excited about this recipe itself. And so let's look at the ingredients for this particular recipe.
Okay.
Chicken salad, 1 16-ounce water-packed tofu firm, 2 stalks of celery diced, 2 scallions minced, 1 teaspoon of garlic powder, 1 tablespoon of soy sauce light, 1 tablespoon of lemon juice, 1/2 cup of soy mayonnaise, and 1/4 teaspoon of turmeric powder.
Okay, chicken salad.
Now I like this particular recipe, and I can do it 2 ways. One into either a mock egg salad and then a mock chicken, because we've been talking a lot about getting rid of all the cholesterol in a diet, especially when we talked about some shows back. We spoke about the fact of too much fat in a diet actually coats the cell, and when it coats the cell, it impedes the ability for the insulin to get to the cell and take the sugar, the glucose inside.
That's
and
true.
so a lot of time we talked about the fact that people use the word sugar diabetes does not mean a lot of sugar. It just means there's sugar present in the blood.
So it's not the cause, and we covered that as well.
But then remember,
They don't
somebody saw that show and said, okay, she said it was okay for me to have my sugar, and I don't worry about the fat.
Because sugar doesn't cause diabetes, so I can have my cookies, cakes, and pies.
Yeah, but really and truly what's happening is the processed foods. We talked about that also, the processed foods where that extra amount of fat and those sugars are there, which causes a problem for the diabetic. And it'll cause a problem for everybody, but for diabetic in particular.
Yeah.
Okay.
Now these foods here, now this can be either a chicken salad or an eggless salad.
Yes.
It's based on the texture of the tofu itself?
It depends on it, and also, yeah, not only the texture, but the type.
Okay.
You know, your firm and extra firms, they do a different thing than your soft and your medium firm. So there are different textures of the tofu, and we talk about all that also in our books as well.
Now, again, so the extra firm would be more of a chicken type texture because it's more...
Or firm or extra firm. Right.
Okay,
right.
and the soft is more of an egg type texture.
Yes.
Okay.
But now, how do we get it to be, if we were trying to make it into those textures, what do we do, Curtis?
Well, what you do is, and this is very critical here at this stage, is this process. If you get your water, if you get your tofu in a water pack, I don't know why my wife is laughing at this time, but if you get your tofu in a water pack, you want to put it in the freezer, whole. Keep it there for at least 2 days, then take it out, you thaw it out, and then you press it against 2 paper cloth towels, press it so that all the water is out, and then you crumble it up, and you have a meat type texture. Is that
all right, all right,
close
all right,
or what?
all right. So you about ready to have your own show. You ready to be your own chef.
You pushing a little bit now. But
okay.
I mean, can you fill in the blanks, or was that sufficient, or what?
You did a good job. You did good. I know Ann out there saying, what? But that's all right.
It wasn't that smooth, but I hope they got the idea. But
anyway,
again, but that can be done because if it's firm or extra firm, it's more of a meaty type texture.
Yes,
if
it
it's
changes
soft,
the texture of it.
it's more of an egg type texture.
Right, right. So what we're going to do in this particular one here is, you know, I talked about the celery. I've already started dicing some of the celery up. So let's go ahead and dice up the rest of that. And then I also talked about the scallion. I'm going to go ahead and dice that up as well. We've already started dicing it up. And you're just going to dice up into nice sized pieces. It goes really, really well with this particular recipe, okay? I'm going to start, as Curtis is finishing that up, I'm going to start mashing up the tofu. Just with my fork, I'm just going to mash it.
Now that's the firm.
Or we call crumble. Yeah,
is that firm?
You can use firm or extra firm. Either one can work on this one, okay?
A lot of people, you know, may not have worked with tofu, don't know how to use it, so this is one way of getting the tofu, the soy-based products in the system.
Yeah.
Has plant protein, not animal protein, so it does not stress out the kidneys. It does not raise the blood pressure. And it has also your calcium and the type of fats that the body needs, the good type of fats. So
and a better utilization of calcium than actually cow's milk.
Than cow's milk, that's true. Yes.
The soy family has that ability. And I'm going to go ahead on and ask you to go ahead and put in, let's go ahead and start that celery in here first. Move the celery in. And we got that one there also as well.
Okay.
Okay. I also like this one because it's very colorful. All right. Go ahead and pour that in. Get all the goodies, all the goodies.
All the goodies, baby.
Yeah.
Okay.
Okay. And then let's go ahead on and do also the scallions as well.
Scallions.
Okay.
Scallions and onions, the same thing? Or
well, they're in the same family.
In the same family,
yeah.
Yes. Okay.
Okay.
And
I'm going to put that in also.
All right.
Now, I also talked about a soy mayonnaise. Okay. We're going to do a soy mayonnaise rather than a regular mayonnaise or salad dressing because, once again, we are limiting the amount of eggs and anything else that might be in that mayonnaise. So we're going to actually use a soy mayonnaise in place of it. But before I do that, Curtis, I would like for you to actually squeeze the lemon so we can have lemon juice in this as well.
Okay, where's my squeezer, though?
What you do with it last, Curtis?
Okay. You just blasted me on TV. Okay, I'm just going to squeeze it right here.
You put it somewhere.
This is going to be hard right here, boy, I tell you.
You can do it. You can do it.
Yeah. Hey, lifting weights really helps out right now.
Yes, it does.
Yes, it does. This is a nice size firm one, too. Mm-hmm. Okay. Now, you want seeds in this or what?
No, I don't think I want any seeds in it, Curtis. Do you see any seeds in there? We'd like to. Oh, you did good. Only one seed's there.
Yeah, only one.
Just one.
Get this out.
Okay.
Okay.
Now let's do this. I want to take this bowl, this one out, and I'm going to have you. We're going to go ahead and make this mixture up. All right. So we're going to go ahead and take our spatula. Let's go ahead and put the mayonnaise, soy mayonnaise, in here. Here you go.
Oh, okay.
In there, and then I'm going to go ahead and also put in the soy sauce. It's the soy sauce light. Or you can use Bragg's liquid aminos. Either one of those can be the type of ingredient you can put into this. I'm going to go ahead and pour that in. Curtis, go ahead. We're going to put in now the onion
powder. Okay, in here.
And we're going to go ahead and put in the turmeric for coloring.
For coloring, yes.
Okay, and then let's go ahead and put that lemon juice in there as well.
All right.
All right, and with your fork, you're going to go ahead and spin that around a little bit.
Spin it around with the fork?
Yeah, just kind of turn it around. Turn it. Yeah.
Do you want me to fold it?
No, I don't need you to fold it. Just go ahead and spin it.
Oh, okay.
Now this, I like this salad because all your seasoning is going to be in here. Okay, it's going to be in there. Good, Curtis. Okay, I'm going to take that spatula, and you're going to go ahead on, and let's go ahead and mix that on in.
Okay.
You do that.
And this gives the coloring.
Because it has to look like that. Right now, it's not as appetizing or as pretty as it's going to be once we mix this all together.
Because we eat with our eyes.
Absolutely.
Is that correct?
Absolutely.
Absolutely.
All righty. Let's stir that up.
Okay.
And what I usually do is I take this then and put it in the refrigerator.
Okay.
Put it in the refrigerator, and I let it get cold, nice and cold. And then I make these luscious sandwiches out of it. Okay? Luscious sandwiches. And so we're going to go away. When we come back, you will see the finished product, so stay by.
Would you like to learn more about preparing healthful vegetarian dishes? If so, then you want to be sure to order our free Abundant Living resource sheet. It contains useful information about products and cookbooks that will help you to learn more about this natural way of cooking. Along with your order, we would also like to include a free copy of the booklet, The Natural Way to Keep in Shape. This 20-page booklet is filled with tips that will help you to develop a total lifestyle approach to health. To receive both the Abundant Living resource sheet and The Natural Way to Keep in Shape, call us at 800-752-3226 during regular business hours. Call and ask for this special offer today.
So welcome back, welcome back. We've completed that mock chicken salad.
Teamwork.
Absolutely, and we like to serve it up on whole wheat bread.
Okay.
And with
talking about that.
The red leaf lettuce also, and a large tomato.
Okay.
And also it serves
chips.
up
Yeah.
with, as a chips. You can take the chips and do it with the sandwich, or you can take the chips and use them separately for the mock chicken salad. You can also do that. Also, it's also a very good beginning to a meal when people are coming over to the house.
Makes a complete meal.
Yes.
Well, this is our last program on Defeating Diabetes series, so I think we need to have a word of prayer, honey.
Absolutely.
Okay.
Thank you, Father God, so much for all you're doing in our lives, and bless those that are watching and listening to the program. Bless all the 3ABN staff, Lord, in a special way. Thank you so much for the things you have written in your word. Teach us about how to take care of our bodies. We ask that you will bless us and keep us, is our prayer in your son's name. Amen.
Okay, very good program. Let's take a little sample of that, honey, and
Okay.
Oh, you got something under there. Okay.
Curtis, you know what?
Oh, okay. Well, now that little bit of sandwich.
Well, if it's not enough for you, then I'll guess I'll have to eat it
John
myself.
10:10, Jesus said, "I come that they might have life and have it more abundantly."